Fatima Hassan, you and I have spoken many times, joining us from the organisation today. So comorbidities, regardless of age, that is the call. One might wonder, won't they, Fatima, how it is we even have to ask for something like this?
Thanks, Gareth, and thanks for the opportunity. And certainly we've been asking for people with comorbidities, irrespective of their age, to be prioritised in South Africa's vaccine rollout program from the beginning. There was early indication from government that they would do that, and suddenly when the program started, they did a U-turn. None of us up until today know why that is exactly so, based on what expert evidence or advice, because the Ministerial Advisory Committee advisories on this particular issue have still not been made public and are not on the Department of Health's website. We believe that there were some arguments that government indicated that because they didn't have the data, that they would prioritize first everybody over 60 and then over 50 and now over 35. But we still have a gap, and that is people living with HIV, people living with cancer, people living with TB who are under 35, who really need to get ahead in the queue and to be prioritized for vaccine access. In the last few weeks,
do we have any idea of numbers, Fatima, that we're talking about under the age of 35? Any idea of numbers?
I don't have the exact numbers. What we do know is that the private sector, particularly medical schemes, are able to give us the data on their profile of their members who are under 35 with comorbidities. But government certainly could do some back-of-the-envelope numbers, because we do have ARV clinics, we have TB clinics, we know who's getting cancer treatment in the country, we know who's receiving treatment for diabetes, for example. And just, in the last few weeks, the WHO has also released a report of new data that indicates that people living with HIV are at greater risk of COVID hospitalization and also COVID death, and that they all should be regarded as special groups for vaccine rollouts in all parts of the world. So this is certainly a call that is in line with international best practice and in line with public health risk principles that are being used elsewhere where there are sufficient vaccine supplies. So obviously the issue is, do we have enough supplies? And that's a separate question that we need to deal with in relation to Pfizer and Johnson & Johnson. But certainly what we really need to do as a country is to get as many people with comorbidities ahead in front of the queue so that we can reduce the number of hospitalizations and also deaths.
And why do you think this wasn't put forward as a priority much earlier on? Yes, we can see at the bottom of our screen, based on age, based on essential industries. Now we're talking 35 plus. Some could argue, Fatima, and I'd like your counter-argument to this, some could argue that now that we're in the 35 and plus cohort, if I can use that we will, just because of a wider age net, get more people with comorbidities. Does that at least put forward the argument that we're trying to get to as many as we can?
So partially, yes. I think, the initial idea or the initial indications was that we were going to start with everybody over 70 because of trying to address the comorbidity issue. And we know the DDG and DGF said this on various public platforms. They decided to include everybody over 60 because in their understanding, most of the people with comorbidities were actually in the category of the age group of over 60. But certainly there are, significant amounts of people who are excluded from this particular age prioritization sort of cohort system. And yes, we've gone some way to including people who are now over 35, but we're still leaving out a critical number of people who really need to be prioritized. I mean, Delta variant circulating, we're in wave 3. We're really worried about hospital admissions and about the factors that make you predisposed to COVID hospitalization in particular, not necessarily just illness. And a lot of the public health experts and doctors that we have been working with are calling for this. They're seeing this amongst the patients that they have in their particular practice, whether it's in the public or the private sector sites. And I think the issue, again, is around transparency and accountability. So your question, I think, goes to the heart of that. Why was there a U-turn? Where is the MAC advisory on this? I think Professor Barry Shub was on ENCA a few weeks ago, and he said, no, the MAC advisory has been pushing for comorbidities. We haven't seen that advisory. Why is government not listening to that advice? And why is the acting minister not explaining this? I think we'd like to see less tweets from the minister about the coffee generation and more information sharing around how we're going to deal with the comorbidity profile in South Africa, because that's really serious and that's really important.
It is. And the last minute I have with you, Fatima, I enjoyed the comments about the less tweets. Let's talk about this petition in the last minute or so I have with you. What are you calling for? Where do people go?
So the link is on our Twitter handle and also on our website. It's petition.amanda.mobi. So far, we've generated 1,500 signatures, calling on everybody in South Africa to join us in the call for government to prioritize all people with comorbidities who are under 35 for the vaccine rollout.
Well, I appreciate your time in speaking to us this afternoon. Always a pleasure. Fatima Hassan, heading up the Health Justice Initiative, wanting government to prioritise vaccinations for anybody who has comorbidities, regardless of their age.